Good afternoon, everyone. Welcome. Thank you for joining us on this lovely, lovely day. Our presentation will begin shortly. We're just going to give everyone a minute to make sure that their audio is working, to top off their drinks, and we'll get started here. My name's Sarah Wallace. I'm on the right, and I'm here today with Karen Anderson.
Hello, everybody. It's a beautiful day here in Buffalo.
Yes, the sun is shining. Well, again, thank you for joining us. Today we are here to talk about retirement and Medicare. So this should be a really fun time, right? Everyone looks forward to their retirement date. So let's take the stress out of the medical side of it so you can actually enjoy the process. So before we go into it, why AAA? How did AAA get into the Medicare field? And we we were watching the market and saw that this is a hassle. It's a daunting thing trying to choose the right Medicare path or when to do what or understanding what the government needs from you. So being trusted advisors to our community is really why AAA got into this game. We're here to help you. We're free resources. We will help our members and non-members alike just to make sure everyone is empowered when it comes to making their Medicare choices.
And Sarah, one thing that I've always felt kind of proud of is the fact that, yes, we're AAA employees, you and I. However, we're also independent Medicare agents. And what that means is we have a variety of healthcare insurance carriers that we can choose from. And because this process is so individualized, we represent our loyal AAA members. So instead of making our members fit into one plan that we offer, we have several different carriers that we're certified to write business with, and we can find the right plan for each member instead of making each member try to fit one particular plan. So that's what's great about independent insurance agents. We work for you, our member, instead of working for just one company.
Great point, Karen. So today the topics we are going to cover are timelines and enrollment periods. We'll take a quick look at what Medicare is and retiree insurance, how Medicare works with other insurances, and then your responsibilities at 65. So starting with timelines and enrollment. So the first thing first, right, is when are you going to retire? And we're going to talk about all of the different options for you because you may have a plan in mind, but everyone here knows that plans change. So we're going to educate you on what you've got to do, whenever you happen to retire so you can make the best choice for you and your family. So if you are going to retire under the age of 65, you will be responsible for finding your own health insurance until you are eligible for Medicare. So that might be in a retiree insurance plan your company offers. That might be, you become a dependent on your spouse's plan. Or if you do not have those options, you can always get a health plan on the marketplace. But until you are eligible for Medicare at 65, you are on your own. I do want to note, though, there are some things that may make you eligible for Medicare earlier than 65, and that it has to do with disabilities or certain diagnosis that you may have. So if you are already receiving Social Security under 65, give us a call. We'll see if you fit in there. So if you are retiring at 65, it's important to identify what kind of coverage your company's offering you and how long that will last after retirement. Is it going to last to the end of the month? Is it going to last to the end of the year? You really got to understand what they're offering you before you can make those choices. And then if you are going to retire 3 months or more after your 65th birthday, you can actually delay Medicare. Every year you delay Medicare, however, you're going to need to prove creditable coverage for Part B as in boy and Part D as in dog. You'll hear us say that a couple times through this presentation, and it's really important to remember that if you are going to delay Medicare, it's perfectly fine. A lot of people do, especially if they have a group insurance plan through their employer. Just have to make sure you can prove that it is creditable coverage, and we'll show you how. Another thing to note is if you are going to delay Medicare after you turn 65, whoever's holding the policy must be actively working in order for you to delay all of it without penalties. So as long as the spouse who is who is the primary on the medical insurance is actively working, you can delay Medicare. So the timelines are important because that helps you identify what enrollment period you can use. You can't just enroll for Medicare any time of the year. You have to find certain enrollment periods. The initial one is what you enter as you turn 65. It's why you get bombarded with mail. It's probably why you have mail sitting in your mailbox right now from the individual carriers. Your initial enrollment period starts 3 months prior to, includes the month of, and goes 3 months after your 65th birthday. So if you are retiring before 65 or at 65, you're going to be using this initial enrollment period to sign up for Medicare.
So Sarah, for instance, like my birthday is in August. So 3 months before, in May, that's when I could get started on looking into Medicare and all that. And then I would have 3 months after August, for instance.
Right, that's exactly right. Yep.
Okay, yeah.
Mm-hmm. If you're retiring after 65 and you're going to delay picking it up because you have creditable group coverage, when it's time to retire, you'll have what's called a special enrollment period. Special enrollment periods are usually triggered by things like retirement or even moving out of the area. It's important to know about the timeline, however, because you'll hear you have 8 months from the day you retire or the day your health care coverage ends, whichever's first, to enroll in original Medicare. That's parts A and B. What I want you to know is that leaves you open to 20% of your medical costs. You really want to sign up for comprehensive Medicare coverage. So what I want you to remember about your retirement special enrollment period is you really only have 3 months from the day you retire or the day your health coverage ends, again, whichever's first, to get comprehensive coverage. You only have 3 months to sign up for an Advantage supplement or a prescription drug plan. We'll go into those individually, but that's what I want you guys to remember. You have 3 months from your retirement to make sure that you are all set to have comprehensive coverage. So now we understand the enrollment periods and why it's important and maybe what timeline we'd like to retire. Let's talk a little bit about Medicare itself. We're going to do a very high level overview. If you'd like to dig in deeper to these parts of Medicare, we have a separate webinar called Medicare 101. Takes about half an hour and we really go into the separate parts so you can understand. However, for today, since we're talking and focusing on retirement, we're just going to do the high level overview so everyone has the same understanding of each piece of Medicare. So starting in the left-hand corner, parts A and B are original Medicare. And A and B are signed up through Social Security. So Social Security handles those two pieces. I want you to think of Part A as your room and board. It is literally like a hotel bill for the hospital. That is what Part A covers. Whereas Part B as in boy is going to cover your medical care, your doctor's office, your tests, your durable medical equipment, anything along those lines. Part B is going to cover 80% of those costs. So having only original Medicare leaves you open to 20% risk, right? And what does that mean? So 20% of one doctor's appointment isn't too bad, that's manageable. But how about 20% of a COVID hospitalization? What about 20% of a broken femur that you need surgery for, right? So while parts A and B are coverage, you definitely want comprehensive coverage. You want to kind of mitigate that 20% risk that original Medicare leaves for you. And you do that with either an Advantage or a Medicare supplement plan. Now, these are two names for two types of plans that do similar things. You can only have one or the other. But what I want you to remember for today is that the Advantage and the supplement plans, the supplement, by the way, is also when you hear Medigap, it's just another term for Medicare supplement plan. Those are the same thing. So these plans are provided by private insurance carrier. Remember, A and B is by Social Security. The Advantage and the supplement plans are provided by those private insurance carriers, and they're going to help you cover those 20% risk. They're going to either have a maximum out of pocket, or in the case of the supplement plan, you'll have a higher upfront cost, but less costs at the time of a health event. An important distinction between the Advantage and the supplement plan is drug coverage. So a Medicare Advantage plan usually has drug coverage included, where a Medicare supplement plan, you will have to pick up a Part D plan. Now, that doesn't mean it's not a good thing. Karen and I can absolutely help you find the right supplement in Part D. It's just something you've got to note. And why is it important to have prescription drug coverage? Well, in the top right-hand corner there, we'll talk about Part D, as in dog. And Part D really is a government mandated level of prescription drug coverage that all individuals over the age of 65 must maintain. So that includes if you stay on your employer's group health plan, they're going to want to make sure that it's creditable, that you have at least this minimum level of prescription drug coverage. So we keep saying creditable, right? We want to make sure that whatever plan that you are on after the age of 65 is creditable for Part B as in boy and Part D as in dog, because those two parts of Medicare come with late penalties. If you do not sign up for Medicare on time and you do not have a creditable plan after the age of 65, both of those parts come with lifelong penalties that you will not be able to pay off, and you will pay month over month for the rest of your life. So we want to make sure that you avoid those. That's why me and Karen are here to help you avoid those pitfalls like having to pay penalties. One thing I want to bring up about original Medicare is there are costs. Part A usually comes to you as an entitlement. If you or your spouse have paid into the Medicare tax for 10 years or 40 quarters, when you sign up for Part A, it may come free of charge. It's not entirely free, right? Because you did pay into the taxes, so it is considered as an entitlement. Some people who are working past 65 and who have health care through their employer still pick up Part A just as an extra level of coverage because it is an entitlement and does not come with a cost month over month. Part B as in boy has a monthly cost of $148.50. That's the 2021 monthly premiums. And then Part B is what people usually hold off on when they stay under their group health coverage through work. So if you hear some people say, I signed up for Part A and not Part B, that's why. They have creditable coverage for Part B, and they decided to sign up for Part A because it's an entitlement.
Yeah. It's nice too, Sarah, because you're already signed up with Medicare. They're aware of you, and it just takes that much more pressure off you when you actually are ready to retire. Because then all you have to do is enroll in B, and you're set to go.
Mm-hmm, mm-hmm. So there's a lot to unpack on this slide, and Karen and I could really talk about it all day, but I will save it for you. And if you guys do want to attend the Medicare 101, give us a shout. We'll send the recording right over to you, and it takes a good half hour to go through all of these different parts of Medicare. But we at least wanted to get everyone on the same page as we move forward about what we're discussing today. So the next thing we're going to talk about is retiree insurance. Not every company offers this, but it's important that you identify whether or not you do have it. And it's also important to identify if it's offered to you, is it good? Right? Trust but verify. Is it a good plan for you? So only your benefits coordinator at work or your HR representative for some people at work will be able to answer these questions, but Karen and I can help you understand their answers and what options you have on the table. So you're going to ask your employer, do they have health insurance after you retire? How long does it last? That's a very important question. What are the costs and coverages? How are you going to compare it to what's on the market if you don't know what's covered? How does this coverage work with Medicare when you become eligible? So if you retire before 65, become eligible for Medicare, what does the retiree insurance plan look like at that time? And again, you'll hear us say this again and again. Is that plan considered creditable for Part B, the medical, and Part D, as in dog, for prescription drug care? We really want you to avoid those penalties. So once you ask your work these, you get your answers. You might get a benefits package to show you, what is offered, what are the costs and coverages. Bring that to Karen and I. We'll help you compare. We'll let you know where the plan excels, or we'll let you know what's on the market that's comparable if there is something. Usually we find these retiree insurance benefits are very robust. And if that's what we find with you, we'll let you know why, so you can make educated decisions as you move forward and as your health needs progress. So that is retiree insurance. Make sure to ask if your company offers it. So how does Medicare and other coverages work together? And really, this is how all insurance companies work together. Some of you may already have experience having a primary and secondary payer, but just in case you haven't, we're just going to go over it now. So if you have multiple insurance plans, one will be the primary, and then the others will be secondary. The primary pays first, and it's only going to pay up to the limits of its coverage, and it's only going to cover those things that are identified under their specific plan. Secondary payer comes in if there are costs that the primary didn't cover. So they're both not going to pay you the same amount for the Medicare approved procedure, right? They are going to, if you've already been paid by the primary, the secondary won't pay anything. Secondary will only pay costs if the primary didn't cover anything, and also if those extra costs are covered under the secondary's plan. Let's give you a couple examples on how that may work together. So really, who pays first? If you decide that you're going to keep working and you're going to use your group health plan through work, and your company has 20 or more employees, your primary payer is going to be that employer plan, where Medicare will become secondary. So that's why some people pick up Part A, because again, it's an entitlement and it does provide a little layer of protection if you get hospitalized while working. If you are currently working and on your group health plan through work, and your company has less than 20 employees, Medicare is going to become your primary payer, right? So you're going to want to make sure you sign up for A and B, and then your employer plan will then become secondary. If you work for a small company, come see us, because this line is very, very important. The 20 cutoff is important. We want to make sure you get the right answers and you sign up for the right thing, because you don't want to get stuck with any of these costs. You think you're covered under your employer plan, but you find out that you needed Medicare. We don't want you to run into that late. We want you to know head on going into it what's expected of you. So if you do have that retiree insurance we just discussed, Medicare will be your primary insurer, and retiree benefits will be your secondary. A lot of times when people bring their retiree insurance package to us, it says right on there, you have to sign up for A and B. So it's important to understand what your retiree benefits expect of you as you age into Medicare. Another example is COBRA coverage. If you have COBRA coverage and you become eligible for Medicare, your primary payer becomes Medicare, and COBRA is going to be secondary. So that's just a look at how they work together, who pays what, and why having parts of Medicare may be beneficial. Moving forward, we're going to talk about your responsibilities. I'm going to hand you off to Karen Anderson to go through that.
Okay, well, thanks so much, Sarah. All right, everyone, let's go over and take a little look at do I sign up for Part A and Part B? So let's say that you are retiring at 65. You've been counting down the years and the months, the weeks, the days. You can't wait to retire, and you've decided to retire at 65. So if you're not already receiving Social Security benefits, you'll need to go ahead and sign up through Social Security. The Social Security Administration is the federal government that is charged with taking care of signing up for Medicare. You can do this a couple of ways, however you feel most comfortable. It's really easy to go into to do this online, and you'll find the website listed for you there on the screen. Really will just take you minutes to get ready and do your enrollment for Medicare. You can also call the 1-800 number, and you can speak to someone over the phone, and they can handle that for you. Or you can make an appointment to speak to someone at an office that's located near you. So that's the options that you have available to you. And let's just kind of take me, for example. My 65th birthday is going to be in August of 2023. So let me tell you, right around May this month in 2023, I'm going to be going online and signing up for Medicare. And I'll be getting my Medicare cards within the next couple of weeks. They move the process along pretty smoothly. And then from there, effective the 1st of August, because my birthday is in August, the 1st of August, I will start on Medicare and I will drop my AAA insurance. Depends. Everyone's different. It depends on what the better, you have to crunch the numbers, see what's better for you to do at that time. That's an example of what you can do if you're planning on retiring at 65. Although, in my case, I won't be leaving AAA. I'll continue on working at AAA forever because it's such a wonderful company. However, Medicare can offer some really wonderful benefits, and it can work out to your advantage to go off your company's health insurance and go on to Medicare. So,
Karen, can I just kind of go back to a point you made? This is a numbers crunching game at this time of your life, guys. It really is. A lot of what we do is identify, have you paid your current group plans deductible already? Yes. Well, how far are you towards your out of pocket, and what would it cost you to change your plan? So let us crunch the numbers for you. It's complicated. We can help. Give us a call.
right, right. Another point to make out too, see that red box, on the screen, if all else fails, read the blueprint. Sometimes your employer will make it easy for you because if your group health plan requires you to sign up when you turn 65, well, then you must sign up. So I'll bring that point before I forget, and we'll move on to the next slide. But what about after 3 months? After your 65th birthday. Well, as long as you are covered with your employer's health insurance coverage, or you are on your spouse's health insurance coverage, you really don't have to do anything. Just keep working. However, as we've made the point before, you can enroll in Medicare Part A. And Part A, you're entitled to in the vast majority of cases, there is no premium for Part A. And it can become helpful because in the event you have medical expenses that are left over that you're liable for through your health care plan, um, uh, in relation to Part A, inpatient hospital care, Part A can then pick up some of those expenses. So, and that's nice too, because you're already in the Medicare system, and that just makes it easier for you at such time when you are ready to go on retirement and pick up Part B. Did that make sense, Sarah?
Mm-hmm. Yep.
Okay. So, yeah, so let's move on to the next slide. That's the most important thing about that slide, is what to do as far as Part B is concerned, and being sure that you don't incur any Part B penalties. So just be sure you're either covered under your health insurance plan or your spouse's, or that you move on to Medicare. Well, what about Part D? Part D for drugs. That was the easiest part for me to remember when I first got started in the business. D for drugs. Part D also has a late fee penalty that will follow you for the rest of your life. And we want to be sure that you avoid this as well. So again, just as we did with Parts A and B, for Part D, if you're retiring at 65, ask about your retiree insurance. If there is retiree insurance, Is it creditable insurance, number one? And also, is it creditable insurance as far as your prescription drug plan is concerned? And if it is not, you may have to get a standalone prescription drug plan to avoid any necessary penalties. In most cases, if a company offers retiree insurance, that will include prescription drug coverage, but not always. We won't know that, but your health insurance person, your benefits coordinator at your employer, they will know that question. So if you're retiring after 65 and you are not covered, a prescription drug plan is necessary to avoid penalties. So there are plenty of options available to you, and Sarah and I can help you. And that's one of the most important things that you want to remember when it comes to Medicare. We want to be sure that you can keep your doctors, especially if you like your doctor, like I do. I love my doctor, and I like the idea that I can stay with my primary until she retires or I pass on or whatever, but I want to be sure that I can stay with her. Well, in this case, Sarah and I will be sure that we find a plan to be sure that that doctor is on that particular plan. But the other thing is the prescription drug cost. And if you take nothing else from this webinar, remember this. Prescription drug costs, as I'm sure you know, this is no news to you, but costs can be out of sight depending on the types of medication that you're on. Depending on the plan, some medications will cost you more. Those same medications will cost you less with other plans. Sarah and I can help you with that. And that's why these plans are so individualized to you, because everyone is different. You're all on different medications, some not on medications at all, which is fantastic too. So set up an appointment. We'll be happy to talk to you. So if you're retiring after 65 and you're covered, this is standard throughout the business with all employers. They will provide you an annual notice that says your company has creditable health insurance coverage and creditable prescription drug care coverage. So they send these notices out to you. You may have noticed them in the mail over time and not really known for sure what they're all about. Well, that's what it's about. As you get closer to retirement, save those notices. Medicare will want to see that you've had creditable coverage. And you'll need this when it's time to set up for Medicare to avoid late penalties. Another quick note about health savings accounts. Not all employers offer health savings accounts. However, for those who do, and for those of you who are enrolled in a health savings account, keep in mind that 6 months out from enrolling on Medicare, you should stop contributing to your health savings account to avoid a tax penalty. So if at all possible, when you know you're 6 months out, stop those contributions.
One
And
note
also,
real quick, Karen, that
sure,
money is still yours,
right,
and you can continue to use it. It's just the contributions that get taxed. So we want to avoid, again, we're really big on avoiding penalties. So that's where
right.
this note comes from.
Right, that's right. That the money that you have in that account is still yours to use. We just don't want you to accrue any tax penalties from contributions that you'll be making. So don't make them right up until the day you retire. Try to lay off as best you can, no later than 6 months before. Okay. And the next slide, Sarah. All right. So now, as far as Medicare is concerned, if you haven't already kind of realized this, you will shortly. And for some people, it's kind of a shift. What do you call a paradigm shift? Because we're no longer in the land of family health plans. We are in the land of individual health plans with Medicare. So if you and your husband have been used to pretty much all your lives, you're either on your husband's policy or your wife's policy, or you're switching back and forth, depending on the situation, well, that stops when you get to Medicare, because then both of you will have your own Medicare plans. All right. Do you have to have the same insurance carrier? No, you don't. You can have different health insurance carriers. You can have the same insurance carrier if you would like, but you don't have to be on the same plan. So not only are these Medicare plans individualized based on a family situation, they're individualized for each person within that family or that marriage. So you'll be on your own Medicare plan. So it's important when you're thinking of retirement and you're in your happy place thinking of the golden years, don't forget your spouse. Because if you go off of your insurance, well, what is your poor spouse going to do for health insurance? So you have to remember that there. So let me use another example. My husband, for instance, he went on Medicare back in January, and we were on his employer's health care plan. So the situation with my husband was such that it was much to our advantage financially for him to go on Medicare instead of staying with the health insurance plan that the both of us were on. Well, that's great for him, but that kind of leaves me in the lurch without health insurance. Well, as an employee of AAA, I was able to pick up AAA's health insurance coverage, so I'm covered. My husband is still working, but he dropped his employer's coverage, and he's on Medicare now. So that's how it worked out for us in particular. Okay. I recently worked with a couple that I spoke to, and they are both on his COBRA insurance as he was laid off from his work. And part of the package was that he had COBRA coverage. Well, as you can imagine, that's pretty expensive coverage. However, what they've decided to do is when his wife turns 65 in 2 or 3 months, she is going to come off the COBRA coverage and go on to Medicare. And he'll continue the COBRA coverage until he finds another job and can get on his new employer's coverage. All right. So when you're going into Medicare, don't forget your spouse. That'll make everything a lot less stressful through the Medicare process. So, just think, well, what's going to happen for my spouse when he and I, or he or she are Medicare eligible? And also keep in mind for yourself, well, what happens to me? So if your spouse is continuing to work past your retirement, do you have options under their policy? That's something that you can think about as well. So the policyholder must be actively employed. Whoever the policyholder is, they need to be actively employed. Otherwise, a penalty may be incurred for parts B and D. Okay. Sarah, is there anything else I could have covered under spousal coverage, you think?
No, but I'm going to double down on something you said earlier, right?
Yeah.
Your husband is still working, but on Medicare because it was a better cost option,
Mm-hmm.
guys. So don't assume that your group health coverage is your better option because you're still working. Sometimes those monthly premiums mixed with the co-pays are more expensive than Medicare. And again, we can help you identify what's the better option for that year for your coverage. We really want what's best for you. We
Right.
get our salary from AAA, and AAA is here to support our members.
That's right. All right. And what are the next steps? We would love it if you would give us a call. Give me a call, give Sarah a call, make an appointment. We can talk over the phone. We can meet with you if you would like. We can do virtual appointments over the computer. That didn't sound very tech savvy, but you know what I mean.
We do, though. We do.
Yeah, we do. We do. And we want to thank you so much for joining us here at our retirement and Medicare webinar. So thank you so much for joining us, and we hope you'll call. My information is down towards the bottom there. Again, I'm Karen Anderson. I'm over in the Buffalo side of things.
And
And
I'm
Sarah?
Sarah Wallace. I'm over here in Syracuse, but just so everyone knows, AAA, it goes from Buffalo to Syracuse, Watertown to Ithaca. Give us a call. We can help you understand your health coverage. Thanks for your time, guys.
Thanks, everyone. Have a great day. Bye-bye.